Dr. Gitika Thakur, working as consultant in Obs and Gynae in Chaitanya Hospital. Today we'll be talking about labor. Labor is the series of events happening in the genital tract of a pregnant woman to expel the fetus from the uterus through the vagina into the outer world. In layman language, labor is the process that will bring the baby from the uterus into your lap. Now coming to the beginning of your pregnancy. What is LMP and EDD? LMP is the first day of your last menstrual period. All the weeks in the pregnancy and the events related to it are calculated from your LMP. EDD is the expected date of delivery. That is also calculated from your LMP. However, only 4% of the patients will deliver on the expected date of delivery. Now, labor can be either spontaneous or induced. Spontaneous labor is the labor that starts on its own. However, the induced labor is the labor that is started by giving some medication. Most of the times you will be induced at 40 weeks, that is on your expected date of delivery, if you do not go into labor on your own. There may be some indications for inducing labor prior to the expected date of delivery also. As a patient, what you are required to know is what are true labor pains and false labor pains. False labor pains are the pains that you will experience in the lower part of your tummy, in between your thighs or lower back. They are not associated with any other symptoms like spotting PV or leakage PV. Whereas the true labor pains are the pains that are experienced in the whole of your tummy along with the tightening of your uterus. They may be associated with spotting PV, leakage PV. The true labor pains will increase in intensity, duration and frequency. Now, when do you need to go to the hospital? You will go to the hospital when you start having one contraction every 10 minutes and it lasts for a period of 60 minutes. After reaching the hospital, your general checkup will be done, followed by CTG, that is the tracing of your baby's heartbeat. Now comes the time to do an internal examination. After doing the internal examination, you will be told the dilatation of your cervix. According to the dilatation of your cervix, that is the mouth of the uterus, you will be told the stage of the labor that you are falling in. Labor can be divided into 3 stages. First stage, second stage and third stage. First stage is further divided into the active phase and the latent phase. Latent phase is the dilatation from 1 cm to 4 cm. The contractions are less painful, you are allowed to move freely and you are allowed to eat solids in the latent phase. Once you cross the 4 cm dilatation, you reach the active phase of labor. The labor pains become more powerful and painful and you are allowed to eat only liquids at this time. Your bag of membranes may be artificially ruptured in the active phase of labor to enhance the labor pains and to check the baby's well-being. The active phase of labor may last from 6 to 10 hours. The second stage of labor is full dilatation, that is 10 centimeters. This is the time when you have to push the baby out of the vagina into the outer world. Third stage of labor is the expulsion of placenta, which happens after your baby is delivered. Now, after this long and tiring process of labor finishes, you are ready to welcome your little bundle of joy into this world. Thank you.